Welcome to the PVN College Podcast, where our goal is to grow students in the love and knowledge of Jesus Christ. In today's episode, we're going to talk about COVID-19. How do we love our neighbor in the middle of a national pandemic? Our guest today is John Crowley. John graduated from UAB with a degree in occupational therapy. He also has an MBA from Shorter, go Hawks. He has been working in healthcare for more than 20 years with a combination of outpatient therapy and in-hospital work. He is on a healthcare leadership team and multiple committees. John, welcome to the podcast, man.
Hey, thanks. Great to be here.
You're our first guest, so any nerves? Are you as nervous as I am? Probably not.
No, I'm okay. Yeah, it's okay. Yeah.
Good for you. Good for you. So today we're covering COVID-19, which, as we've talked about before, is a topic and a disease that is almost, and that's a big almost, but is almost, I think, as controversial as it is dangerous. So many different opinions and so much division. And so I think something that will be helpful for us and for our listeners is just some facts, right? Maybe even some tips and tools on how we not only love our neighbor medically, but spiritually. How do we navigate, if that's the right word, how do we navigate such a divisive subject? So before we jump in, any kind of initial thoughts on that before we dive in?
No, I think you're exactly right. And it's really unfortunate that this is controversial and has become political. But I've been working, like you said, in healthcare for 20 years. And, in a sense, we've been preparing for this the whole time. I've taken trainings on what we would do in case of a national or a worldwide pandemic. I remember we did the possibility of a pandemic bird flu several years ago, and we had intense training on how that would be handled. So in some sense, this has caught us off guard, but in another sense, it hasn't. Healthcare has been preparing for this. But at the same time, I'm just standing back and going, I can't believe we are in a pandemic.
Yeah,
and I am continuing to work in healthcare in a pandemic.
Yeah.
I think the field of healthcare is learning things very quickly and already improved the way we're caring for these patients and learning how to prevent spread and things like that. One of the physicians I heard speaking the other day said, we have already, in the past 6 months, learned about 3 years worth of information on how to do that. So
wow.
I think we're catching up. In a sense, we're caught off guard, but I think we've got great people who are working really hard to get this under control.
Well, and I think you've already hit on something that I think would be so helpful for our listeners, but also, if I can say it, for their parents, maybe even on Facebook, where so much toxic information is cycled through and on all kinds of social media. Good news in terms of this pandemic, like what you just said, the fact that the medical community is learning so quickly, that's so encouraging. Already that makes me feel better about the situation. So, well, with that being said, it seems pretty obvious that I need to just let you talk some more. So we've got 3 questions for you. Okay. So if you'll answer these, and then I'll kind of tag along a little bit too. But so first one, can you give college students, that's kind of the bulk of our listeners, okay? So can you give college students maybe 3 tips or tools for loving our neighbor on campus and helping to prevent the spread of COVID?
Yes, I can. Of course, we're instructed to love our neighbor,
right.
And we should do that always. But in regard specifically to COVID and how to prevent spread, we want to practice the 3 W's. Okay. 1, wash your hands. That is so important. Our hands are what we interact with our environment with. Yeah. And then we are often touching our face and things like that. Wash your hands frequently. The second W is watch your distance. The practice of social distancing, maintaining that 6-foot radius if you can when you're out in public. And then finally, W, wear a mask. And I know there's a lot of controvery around mask wearing.
That's question number 2, actually.
But I'm a believer, particularly if you can't maintain that social distance, that wearing a mask can be very effective in preventing spread.
Gotcha. So just to review, right? So I know college students, especially sometimes, I remember in college when the professor would fly through stuff and I think, ooh, that was really good, but I missed it. So we'll back up. So the 3 W's.
3 W's. Wash your hands.
Got it.
Watch your distance and wear your mask.
And wear a mask. So washing your hands, I've heard kind of the happy birthday to yourself kind of thing. Is that true, or is that just something people say?
That
or?
is good. That's a great way to wash your
think
hands. The other one they said sing Yankee Doodle, right?
Okay.
But
okay.
soap and water is very effective
Yeah.
in killing this virus. But I think the alcohol gels and whatnot are very effective as well. So
Gotcha.
now that you can get it again, for a while the shelves were clear, but it's readily available. Keep a little bottle of gel everywhere in your car, in your pocket, in your purse, wherever, and use it frequently.
Good to know. Okay, good to know. So wash your hands, watch your distance, and wear a mask.
That's it.
To your point with wearing a mask, it's interesting. My wife showed me a couple of days ago. She said, "Watch this," and she's a big candle lighter in our house, scented candle. And she put on a mask, and she tried to, and she is right next. I mean, point blank at this candle, and she's trying to blow it out, and she can't do it. The mask, and I just thought that was such a good visual exercise for me to see, wow, these things are very effective in terms of not letting anything out. That was huge for me.
It is. And there's just been so much sort of controversy and misinformation about masks and are they effective and are they not. And I think the reason is because no mask is going to be 100% effective.
Sure.
It's not. And you have different types of masks. Where I work day to day, we're wearing level 1 mask.
Okay.
That is different. We have level 2 mask, level 3 mask, and then you have the N95.
Okay.
Now, if I were caring directly for someone with COVID-19, I'd be wearing the N95. That is the most protective mask.
Okay.
But even the N95s, that is the standard. They're not 100% effective. They measure those based on the particle size that can get through. And viruses are very small, very small.
Right.
So there's the controversy. You cannot say a mask is going to provide 100% protection.
Right.
But what we know about this virus is it's spread by droplets, water droplets, respiratory droplets. So when you speak, cough, or sneeze, you're going to emit droplets into the air. This is not an airborne disease. It doesn't flow around in the air and hang out there.
It's not an airborne disease.
It's spread by water droplets. So these water droplets are going to come out and they're going to land somewhere.
Right.
It's not going to stay in the air. Now, they'll be there for a bit floating around. But if you just think about that, water droplets, and you put some sort of barrier between the person talking, sneezing, or coughing, it's going to reduce the number of droplets and it's going to reduce the distance that is emitted.
Yeah.
So think about something simple like a Windex bottle.
Right.
If you spray that into the air, you're going to be able to see how that spreads out.
Right.
But spray it into a paper towel.
Right.
You're probably going to get a little moisture on the other side, but it's not going to spread out for 4 feet and land all over everything. It's going to capture some of that.
Makes sense. No, that makes perfect sense. So speaking of masks, so let's talk about our neighbor here. Okay, John, question number 2. I'm talking to someone who says, I don't want to wear a mask. I'm exercising my right and my freedom not to. How do we lovingly engage with that person? Any thoughts on that?
Well, I think first, we have to have mutual respect, even if we disagree.
Right.
People are trying to make decisions based on the information they have.
Yep.
And, they may have different information than we do. They may be misinformed. We may be misinformed. So our opinions may be different for valid reasons. But I'm going to say this. We could try to educate what we know. All right. And there was a study in Health Affairs, and they looked at some of these communities that did mandatory masking. Mandatory masking when out in public, and their spread rates dropped.
Okay.
That's scientific research that showed that.
Easy to communicate scientific research.
And they also showed that even cloth masks, so it's kind of hard, like the masks like we wear, level 1, level 2, N95s, they're rated. But even homemade masks in this study were effective in reducing the spread of droplets, which is how the virus is spread.
Right.
And so I think any type of a face covering is going to reduce the transmission and spread. So we could do some education around that with people. We could talk to them about that. But specifically, if you're looking to love your neighbor and protect your neighbor, someone might say, well, I'm not going to wear a mask. I don't care if I get it. I'm young. I'm healthy.
Right.
I'd be okay if I caught it. Maybe not. But the issue is when you wear a mask, you're protecting people around you.
That's right.
And you say, well, I don't have COVID-19. You think you don't. We have seen a lot of cases in our community and all over the world where people are getting COVID-19 with no symptoms. So it's so weird. We have people that have to be hospitalized and put on ventilators, and we've had a lot of people die with COVID-19. And we've had some people with the same disease test positive with no symptoms. They didn't know they had it. No fever, no coughing, no shortness of breath.
Right.
But if you have it, you still have the opportunity to spread it. And so that's where So if you and I, if I have COVID-19 and you're wearing a mask and I'm not, you're protected a little bit. If you and I are together and I'm wearing the mask, you've got even more protection than if you were wearing it. And then if we're both wearing masks, even
Right.
more so.
Right.
So if you're concerned about your neighbor, one, you don't know 100% sure unless you've just completed a test today. You don't know 100% sure that you don't have it.
Yeah.
And if you want to protect your neighbor, a mask is the best way to do that.
Yeah.
If you can't distance.
Well, and I
wear a
think,
mask.
you said some really good things there too, John, especially in terms of respecting those who have difference of opinion. And again, it reminds me, it's the age-old thing from Scripture, but to speak the truth in love, right? To communicate what we know, to try to educate as best we can. But I would wager, now I haven't seen any studies on this, but I would wager 9 times out of 10, if we communicate the truth that someone else doesn't agree with, if we do it in love, I think there's a greater chance of them maybe not listening to us, but maybe wanting to listen to us a second time. You know what I mean? Sometimes keeping that friendship alive and working in the long run is just as important as trying to talk to them just for the first time, just trying to get it across one time. Maybe back off a little bit, speak the truth in love, do the best that you can, and play the long game a little bit, and just trust the Lord with the results.
Keep your rapport with that patient.
Yes.
With that person. And then,
right.
Either
Either one, both
person.
important, I think.
Keep your rapport, and then, you have the opportunity to continue to talk. And same way with spreading the gospel, right?
That's exactly. That's
Try to hit somebody over the head with your Bible, they're not going to listen to you.
Right. No, I think that's wise. So kind of the last thing here, John, last question, and I think we've kind of started to hit on it a little bit. How do we love our neighbors who don't agree with us on these issues in terms of masks and social distancing or whatever? Maybe they have an opinion about it that just makes you so angry. How can you possibly think that? How do we love our neighbors who are hard to love during this time?
I think you have to start with grace. We need it.
Yes.
And then we need to give it. All right. So we need grace, forgiveness, and we need to give it as well.
Yep.
I think, bigger context, though, is gratitude. This has been a difficult time. It's been stressful. It's been a stressful time to work in healthcare.
Yeah.
It's been a stressful time to have children in school. It's been a stressful time to try to do anything in public.
Sure.
And realize that people are stressed out. And someone may be a little rude, quicker than they might normally be when they're not so stressed.
Yeah.
People may be a little bit quick to react to things that they wouldn't normally. So giving that little bit of grace. And then one thing I've tried to focus on a little bit is gratitude. There's a lot of research on gratitude journaling and things like that. And people who practice gratitude, either daily, writing in a journal or just take time to think about things they're thankful for, they're healthier, they have better relationships, they're less stressed. And this is just a great time to do that. And I hope that people can look at COVID-19, this pandemic we're in, and Brian, some people have lost family members to this, so it is a terrible thing. But I hope that everyone can look to at least one thing related that was positive for them. And I know for me and my family, I can look at COVID-19 and find some positives there, just in the way things have happened for us and how we've had to change some things.
Yeah.
There have been some positives.
Yeah.
And I think we can be grateful and thankful to God even during this pandemic. Another thing we can be thankful for is I was reading an article the other day. They were talking about when Ebola spread through the Congo, 75% death rate.
Wow.
So we can even be thankful to God that we are dealing with COVID-19 and not something like Ebola.
In the grand scheme, that makes sense to me. I think, perspective is so important, and I think that's one of the things that you're harping on, especially. But also, I really like what you said about. Man, I think, like we just said at the beginning of this podcast, COVID is, there's obviously intense medical danger to it, but spiritually it has created such a tight space for all of us in terms of anxiety and maybe even depression or fear or making us, giving us a shorter fuse than we normally have. And I think that if we can remember that is so important. That's going to be key. I think that's key to the church's survival spiritually, maybe the same way masks are medically. Not that they're on the same plane, but you see what I'm saying? Like in terms of it's good that the two church members are healthy, but if they're both at each other's throats and neither of them come back, the church has still lost people,
And the other thing too, with things shutting down and not being in church and not being able to maybe go volunteer places, faith and good works is what we're called to, right? So
Right.
I think COVID-19 has taken away a lot of our good works as Christians and as people.
I think you're right.
We just need to look for ways to continue to do that.
Well said, John. So last thing, just real quick before we head out, if a college student wants to know or is curious about facts concerning COVID-19 or studies or really trying to get the right information in an era of so much misinformation, where should they go? And any last thoughts on that?
That's a tough one because the information comes out frequently and it changes often.
Yeah, that's good.
But I think just being generally aware, if you can find, it's pretty easy to research scientific journals and things like that. If you really are interested in the facts, you can do that.
Sure.
The CDC is putting out the best information they can. Sometimes it does change, but I think we just have to remember this is a new virus and we're still learning about it.
Yeah.
And we may not know for decades the full impact and implications of this virus.
Yeah. No, that makes sense, John. One of the things, just from the other side, the Gospel Coalition is an awesome blog, and they have a great article called 4 Reasons to Wear a Mask Even If You Hate It. Pretty on the nose there, but the Gospel Coalition, 4 Reasons to Wear a Mask Even If You Hate It. I also want to recommend, speaking of masks, we have these wonderful PVN college masks. They're out now. We're super excited for these. Message us if you would like one, and we will be sure you get that. And we'll put links to some different resources and further resources with this podcast. So in closing, just, John, thanks for being with us today, man.
Hey, I was glad to be here, and I've enjoyed it, and I appreciate your ministry and being able to participate in it. And when you link, if I could give you one more thing to link, because here's another way that someone could love their neighbor. If you have had, or you have a family member, a friend who has had COVID-19,
right?
Brand new FDA just approved convalescent plasma as a treatment. And I want to tell you, we've used it locally and it works. It's
really
helpful. So you can donate plasma if you've had COVID-19 and recovered.
Yeah.
You can donate plasma and that will help your neighbor. And
Wow.
you can get more information at that with plasmatx.org. TX stands for treatment. Plasmatx.org.
Plasmatx.org. Well, that's perfect. Well, thank you, John. For more information on this topic, and if you have some feedback or a question for John or myself, message us on Instagram at PVN College, listen to us on the PVN College podcast, or watch us on the YouTube page, Pleasant Valley North. We love you guys, and we'll see you next time.